Hello. Today we will be practicing IV push medication administration. We will first go over our doctor's orders, and today our patient is Mary Edwards. Her date of birth is February 2nd of 1940. She has allergies to penicillin, and she is being treated today for fluid overload. So the doctor has ordered Mary Edwards bumetanide 0.5 milligrams IV push over 60 seconds. We will now gather the supplies that we need for this procedure. So for this procedure, we will need our IV arm, 2 normal saline flushes, as well as a 3 ml syringe with a needle, alcohol prep pads, hand sanitizer, the medication itself, and gloves. A sharps container, as well as a trash can. So we will first wash our hands. After we wash our hands, we're going to check our medication, make sure we have the right medication and the right dosing for this medication. So we have our medication vial. First, we're going to check the expiration date, which is April of 2027, which is right there. And we have bumetanide. There is 1 milligram in 4 mLs. So we will be drawing up 2 mLs, which will equal the 0.5 milligrams. So we always want to review the rights of medication administration. In this case, the right drug would be the bumetanide, and we have already verified that that's the medication we will be administering. The right dose, we did the calculation. In this vial comes 1 milligrams per 4 mLs, and the doctor had ordered 0.5 milligrams, so we will draw up 2 mLs. The right time, which is now, we will be administering this medication today at this time, and the route is IV, and it will be IV push over 60 seconds. And the patient is Mary Edwards. Her date of birth is 2/2/1940, and we will check when we get into the room. And the last rate is documentation. Once we have administered, we can go ahead and document and write a nurse's note if needed. So we have the medication. We will now take off the cap. We take off the cap. We're going to clean our hub in a circular motion. We also have our syringe with our needle connected, so we will open that. We also have to check the expiration date on it, and it expires June 30th of 2024. It's down here, sorry. So we will now proceed to open. Toss it in the trash can. We will pull the 2 mLs of air. We will then uncap our needle, remove our alcohol prep pad, and then pull out the desired amount, which will be 2 mLs. I want to make sure there is no air bubbles. We have drawn our desired amount, which is 2 mLs. We will now remove the syringe from the vial. And using the scoop method, we will scoop up our cap. Now we will label our syringe with what medication it is. And date and time. Once we have our label, we will put it on our syringe. And now our syringe is ready to be administered. We will then review again, make sure we drawed up the right medication, which is bumetanide. We drew up 2 mLs, which equals a 0.5 milligram dose that we would be administering for our patient, Mary Edwards, date of birth 2/2/1940. Her allergies are penicillin. Now we are ready to go administer our medication. Here we have 10 mLs of normal saline in each syringe, and the expiration date is 9/30 of 2023, and we have 2 of them. So now we have gathered all our medications and supplies, and we can go ahead and to see Mrs. Edwards to administer her medication. So this is Miss Edwards. Hello, what is your name? The patient is stating that her name is Mary Edwards. We check on the Ivpm. We verify that her name is indeed Mrs. Edwards. So what's your date of birth? She states that her date of birth is 2/2/1940, and we again verify it with the ID band. We will now also go ahead and verify her allergies. So Mrs. Edwards, do you have any allergies? She states that her allergies are penicillin, so we refer to her ID band, and indeed, she is allergic to penicillin. We want to make sure that we briefly explain the procedure to the patients so they understand what's occurring. So Mrs. Edwards, the doctor today has ordered some bumetanide. This will help with the fluid overload. You'll be getting 0.5 milligrams, and it is in 2 mLs. It's going to go straight through your IV, and it's going to be IV push. Do you have any questions? She stated she had no questions. So now we can initiate our procedure. We will wash our hands, don on gloves, the first thing we're going to want to do is assess the site. Make sure that the dressing is intact, that there is no warmth or redness or anything else going on. After we have done that, we will start with our first syringe of normal saline. We're going to uncap it. We're going to break the seal. We want to clean the hub on the IV itself and make sure we are unclamping the IV. So we're going to clean the hub. The syringe in. So we are flushing the IV. We're asking her to see if there's any pain or any discomfort with the flush. It looks good. It looks like no infiltration or any infection occurring. Once we have flushed the IV and we make sure that it is running and it's patent, we will now disconnect and connect our medication. So now that we have checked that our IV is patent and our site looks good, we can now proceed on administering the medication, which is bumetanide, 0.5 milligrams and 2 mLs, and we can proceed. We will uncap the needle from our syringe, dispose of this in the sharps container. We will again clean the hub of our IV. We will now attach the syringe to the port. Screw on the syringe, and now we can proceed in doing IV push. We will give 1 ml in 30 seconds and then the next ml in the other 30 seconds. So at this time, we will be monitoring our patient, making sure she doesn't have any discomfort with this push. And we will be looking at the timer and pushing slowly. Mrs. Edward, is this okay? The patient states that she's fine and we can proceed. Now we have completed the medication administration. We will now disconnect, discard of our syringe, take out our second normal saline, uncap, break the seal, make sure there's no air bubbles. We will now as well take another alcohol prep pad, clean the hub, and then the flush, we also want to give it at the same pace we gave the medication, because there is still medication in the IV line, so we want to make sure we are pushing it slow. Once we have pushed in the rest of the medication with our flush, we can proceed and flush it. Once we have flushed, we want to make sure we clamp our line. So we are creating the lock. Now we can proceed on disconnecting, discarding the other saline flush, removing our gloves, washing our hands. We always want to answer any of our patients' questions, as well as leaving them in a safe, secure position, and always with the call bell within reach. All right, Mrs. Edwards, we have completed the medication administration of the bumetanide. Do you have any questions? She has no questions. I'm going to leave you here. I will give you your call bell. Call me if you need anything. We can proceed on exiting the room and complete our documentation. We will proceed and document. So we will sign and the time that we had administered the medication. We can write a nurse's note if a need be, and what medication was administered and how the patient tolerated, and if there was any complications with the procedures. We have signed our MAF. So this is the practice video for IV push medication administration.